So today we'll talk about breast reduction, which is medically called reduction mammoplasty. So breast reduction surgery is done for people who have breasts that are bigger than the regular range or normal range for the particular community. And usually people with very big breasts have certain symptoms. So like shoulder pain, back pain, some people may even have feel heaviness on the chest or chest pain. So all this in the type of symptoms. Some people may even have certain kind of mental restrictions because of the size of the breast. And the good news is that usually when we do the surgery, all the physical symptoms disappear, all the pain and discomfort disappears after we've done the surgery. So basically the treatment for macroplasty or big breast is surgical. There's really no other treatment that's very effective except for massive weight loss. But some people even have their BMI weight that's within normal for their height and for their height, but yet they have very big breasts. So in that situation, weight loss may even play a role. It's somebody who's really also have a very high BMI. But even in that situation, then the breast ends up saggy with a lot of loose skin, which is also a problem on its own. So, basically the treatment for a breast size that is causing symptoms is breast reduction surgery. And this surgery is a surgery that can be done very safely. So usually you need to have a consultation for an assessment to see, to discuss with you the options, because there are a number of surgical approaches and options. And your surgeon will discuss with you the approaches and the options. And then you also need to be evaluated for anesthesia, because you're going to have anesthesia. So you evaluate for anesthesia and for major surgery, because it's major surgery. By and large, this is surgery we do very safely. And carry very it's a planned surgery which has zero risk to life. A planned surgery which has zero risk to life. And so if you think that you're having symptoms from the size of the breast, then you should have a consultation to have this evaluated. Certain questions that people have asked in the past is, if I have a breast reduction, can I breastfeed? This all depends on the proportion or the quantum of the breast tissue removed. For example, if less than a quarter of the breast tissue is removed, then the person, if ordinary the person will breastfeed, then the person will be able to breastfeed. And this is what if ordinary the person will breastfeed, because it's not every woman that will successfully be able to breastfeed. About half of women, even normally, without any breast procedure, have challenge with breastfeeding. So if you're the person that will normally breastfeed, then will make sufficient breast milk. Then if less than a quarter, let's say 1/4 of the breast size is removed, then you should be able to breastfeed to to a large extent. If about half or more than half of the breast tissue is removed, then the chances that you're able to breastfeed reduces drastically. So that's where I would say that. So maybe in that situation, you just prepare your mind that you may not be able to breastfeed if half or more than half of the breast tissue is removed. Because what happens is there are about 16 to 20 milk ducts that opens to the nipple. And when we do the breast reduction or part of the breast tissue, some of these milk ducts inevitably or expectedly will be removed with the breast tissue. So this is why if you are removing a large proportion of the breast tissue, then breastfeeding becomes a challenge. The other question that people sometimes ask is about nipple areola sensation. So that also depends on how much breast tissue is removed. If very little small breast tissue is removed, then we expect that, in my experience, I expect that you should retain the sensation to the nipple areola. But if by the time you are removing more than half of the breast tissue, you feel like you have to remove about 2/3 of the breast tissue, then that begins to affect the sensation of the nipple areola complex. So these are the common questions that people usually have asked me in the past. So if you have any question, please feel free to send in your question. I'll be very much happy to answer your question. Yeah. So maybe a question about the topic we consider today, breast reduction. Maybe a question about another topic. So whatever questions you have, please send in your questions. The topic which we take today is breast reduction. If you're just joining us, we'll post, and after this session, we're going to post the video, and you can listen to the discussion, and yes, so that you can have the right information about the procedure. So this is generally a very safe surgery we do. Yes, very safe surgery. So you just need to be, from a medical point of view, prepared for the surgery, which your surgeon will do. We do certain tests to make sure that the organ functions are in the right place, and then you should have the surgery successfully and everything should go okay. Thank you very much for taking time out of your busy life to join us in this live session, and I wish you a great rest of the week. Have a great week. Thank you very much.